Did you know that there is no federal law in the United States that requires public schools to teach medically accurate sex education? That means that it is left entirely up to the states. So, because it is left up to the states, there are only 26 states in the US that do require medically accurate sex education to be taught. Now, some of the other states do mandate sex education, but mandating sex ed and requiring medically accurate information are two totally different standards. So the states that have sex ed mandated basically means that they just make sure that the public schools teach something. It doesn't have to be scientifically accurate, but it's just something. And a lot of the times that something happens to be abstinence only education. And then the states that require medically accurate information are actually teaching scientific backed information to their students. However, even in the 26 states that do teach medically accurate information, don't always include comprehensive education. When it is comprehensive, it is including things like pregnancy prevention, STI prevention, anatomy, consent. It is having all of those conversations and not just the birds and the bees conversation. And unfortunately, even in the 26 states that do require medically accurate sex education, aren't always comprehensive. So mandated education doesn't mean medically accurate education, and medically accurate education does not mean comprehensive education. And unfortunately, comprehensive sex education and reproductive health education is quite literally not required in this country. And as a biomedical engineer who studies female reproductive health, I will say it until I'm blue in the face. This medical education gap is what directly shapes care, and we see this directly impacting patient outcomes. It all goes back to reproductive health education being completely flawed at the foundational level.